These are the different types of ice packs that we use at the clinic. These square ones are usually for backs. The patients can sit up against them on a chair or they can lay on top of them. This one right here is for the ankle or foot. You just slide their foot in here and wrap this around like this to keep it on nice and tight. And then this one we use for pretty much everything else, shoulders, knees, hips. And we just keep these all in the freezer when they're not being used. When you set up a patient with ice, you offer them a towel because some patients are a little more sensitive to the cold. If they don't want a towel, you still get one of these paper pillow cover things and place it over the ice just as an extra precaution for sanitation. And then you always set a timer when they're on ice, and you check on them when they're about halfway done, just to make sure they're doing okay, it's not too cold, and that it's getting all the right spots.
One other quick thing I wanted to mention is that when you are putting people on and off of ice and heat, make sure that you are switching which ice packs and heat packs you're using so they're the hottest and the coldest they can be. That will give the maximum effect. So don't use the same ice pack over and over again. Try to rotate them through.
Once it's time for ending treatment, then you're going to check the chart and see what it is. So this patient is going to have ice and Premod. So you're going to come over here and grab the ice pack that you need. So I'm going to use this one. And then you're going to ask the patient if they want a towel or not. Megan, would you like a towel with your ice?
Sure.
Okay. Then you're going to come over to the cupboard and grab a towel. And if they don't want a towel, then you're going to use a paper towel instead, so it's more sanitary. And then to do Premod, you're going to come over here and you're going to take an alcohol wipe and you'll sanitize the area that you're putting it on. So we're going to do the middle of the arm. Take the pads, and with Premod, it needs to be the same channel. So for every machine except for this one, it will be the same color. So you would take red and set them up, or black and black and set them up across from each other. For this machine, you're gonna look at the numbers. So the little numbers are right here. So I'm going to take 1 and 1 and use those. Now that you have your pads, you'll take the hand sanitizer and clean them. And this also helps them to stick a little bit better. Once they're dry, you're gonna put it on the area that you cleaned with the alcohol wipe. And with Premod, it's always going to be straight across from each other. Once the pads are in place, you'll take the ice and you'll wrap it around the injured area over in the drawers. Once the ice is in place, you're gonna come over to the machine and you'll click the home button. Then you'll make sure it's on the correct channel. So right now we're on channel 1 because that's the number I used. You can also check the order of the cords. So you'll select the channel you need right here. I'm on channel 1, so I'm good. Then you'll go over to electrotherapy, and then you'll select Premod right here. It's set up on the usual treatment time and intensity. If you need to edit it, you can click edit right here and it'll take you to a screen where you can do that. We want to do the normal Premod with Megan today. I'm going to start turning it up, Megan, so let me know when you can feel it. And you want to make sure that you're watching the conduction to make sure that it's good. It's a little black bar at the bottom. And if the
I can feel it, yeah.
Okay. And let me know when it's comfortably strong.
Okay, that's good.
Okay. Then you'll press start, and you will always set a timer so you know that when they're finished. You want to make sure and emphasize that if they have any pain with the treatment, we don't want that, and they should call us over and we can come and help them so it doesn't hurt.
This is how to set up Premod on this machine. So you come here where it says Premod, you hit that. It's already set for 10 minutes. You make sure it's on the correct channel, 1, 2, 3, and 4, and you can adjust that right here. You also make sure it's on the right setting, high, low, or alternating high-low. You can adjust that right here. And then you start turning it up and you tell the patient to let you know when they feel it And then you keep turning it up until it's strong but comfortable, and you push start.
So this is how you set up Premod on the dinosaur machine. So you're gonna come over to the machine and turn it on right back here. And once it's on, you're going to select the side you need. So this is side A and this is side B. So we're gonna use side B. Then you're going to select premodulated, that's Premod. Oh, oops, sorry, we're gonna run through that again. So side B, Premod. And then you're gonna select the channel you need. If you're doing one set of Premod, then you'll select channel 1 right here for this one. If you're doing channel 2, this one, you're gonna select channel 2. And if you're going to be setting up Premod on both, you'll select channels 1 and 2 when you're using both sets, of course. So we're gonna set it up on channel 1 today. Then you'll select the regular setting of right up here. It's 10 minutes for 8150. If you need to do high-low, that setting is right here. And if you need to do a custom setting, you can do that right here. Once you select your channels, we're going to do regular today, then you'll put the pads in place. Once you have them in place, you'll start turning it up until the patient can feel it. And then once you get to that point, you'll turn it up until it's strong but comfortable. And you want to make sure you ask the patient that. And while you're doing that, you want to make sure you're watching the conduction level here to make sure that it is high. Otherwise, you need to check the pads. And once that's done, you're going to press start right here.